Hi, everybody. It's Jean Sachs. I'm the CEO of Living Beyond Breast Cancer. And I am really excited today to have a conversation about scalp cooling or cold capping, whatever you want to call it, but a process by which you can reduce or maybe really maintain your hair during chemotherapy. And there's a lot of information to absorb and some key decisions you need to make before you start treatment. So we are so fortunate today to have Dr. Vered Stearns with us. Thank you. And she has a lot of information to share. She is the director of Women's Malignancies Disease Group and a professor of oncology at Johns Hopkins Medicine. So thank you so much for joining us.
Thank you so much for having me today, and I'm delighted to talk about this important topic.
Great. So let's just start at the beginning. What is scalp cooling or cold capping, and how does it preserve hair?
Sure. So as most of your audience knows, chemotherapy is given often to all types of cancer, and in particular, in the patients I treat, we give a lot of adjuvant chemotherapy. So it's usually a short course, 3 to 6 months of chemotherapy. And chemotherapy kills cells that grow fast. So our hair follicles grow fast. And because of that, many of our chemotherapies, not all, but the majority that we use today, are associated with complete hair loss. And it usually happens between 10 days to 2-3 weeks from the first treatment. And I often tell my patients, you think about it and sure, it's hair, it's gonna, I'm going to lose it, it's going to grow back. But when it happens, it's real, and it's some things that's very hard for a lot of women to go through. So several years ago, there've been several companies and entities that try to find ways to preserve hair during chemotherapy. And the approach has been taken and refined over the years is the scalp cooling. And basically what we're doing is we're freezing those hair follicles during treatment. And what it requires is to cool the scalp just before the start of chemotherapy, during, and a little bit after, to ensure that the chemotherapy is not able to get into these follicles and therefore preserving the hair.
So I know there's at least two, there may be more ways to do this, that some institutions have a scalp cooling unit, and then other institutions that don't have that, you can buy the gel cap. So can you help our audience understand those two things?
Absolutely. So one of the things that have been most difficult for me as a physician, and as I was thinking about it for my patient, was how to make it accessible to them. And it does require time from team members and of course from the patient herself. So it's sometimes very difficult to make part of your standard operating procedures, if you will, before and after chemotherapy. But at least in our center, we were fortunate to move to a new building about 3 years ago, and we're able to have the space to bring in a couple of units. And the differences is that if you use the gel caps, a lot of this does fall on the patient to make sure that she gathers what is needed, whether it's the cap, the dry ice, or other cooling mechanisms. And the cooling with those that don't have a unit may not be as consistent and complete as some of the newer machines that are available to us, the units that are preserving uniform cooling throughout. So it depends, obviously, where you go to get your treatment and whether this is available to you. And I've looked into that for several years now. And as I said, only when we're able to move to a new space, we're able to incorporate it as part of our chemotherapy administration operations. And I'm happy to share a little bit more detail as we go along with the conversation.
Okay, that's helpful, and we can provide resources so people can find if there is a unit and if not. But you're right, if you get the gel caps, it is a lot more responsibility on the patient getting the dry ice and making sure the caps fit correctly. So let's just talk about, I know it can be very effective depending on your hair type and the type of chemotherapy you are getting. So help us understand where is it more effective and where is it not, maybe less effective?
Scalp cooling may be effective in situation depending on the type of chemotherapy that's administered and also hair type. So some of the more published and known data relate to the type of chemotherapy, especially in the adjuvant treatment of breast cancer. So for example, women who are getting anthracyclines, adriamycin is the mainstay in the United States at least. The cooling may not completely ensure that the hair is not lost. So it's about a 50% protection. Now, having said that, it's possible that the hair loss will not be as complete, or maybe the hair growth will be more rapid. So those are some consideration that a woman have to take in when she's looking into this option. With the taxanes, and honestly, a lot of our treatments today are more taxane based. For example, women who have HER2 positive disease, they may be less likely to get anthracyclines today, they may get more taxane based treatment. And even some women with other tumor subtypes may get docetaxel or paclitaxel based treatment without anthracyclines in time. And if so, the protection is a bit more complete. So it's more likely that they will preserve their hair, or if it thins, it may not be as complete. And again, the growth may be more rapid. Regarding hair type, we don't have as much published information. We're just starting to understand it. There's some anecdotal reports, and we in Baltimore City, about 20-some% of our patients, probably a larger percent of chemotherapy administration is to Black women. And we observed that there's less hair protection in those women. And we work closely with one of our dermatologists, Dr. Crystal Agu, to gain a better understanding of not just hair type, but also the different hair processing that women might be going through, and what they might be able to do prior to scalp cooling to enhance the protection. And some of this we've learned the hard way by starting and learning. And the bottom line is women who have thinner, straighter hair are more likely to preserve the hair. And it's probably because the cooling effect, it's easier to get to the scalp than if a woman has a thicker, more wavy hair, if you will. So in general, we do recommend that if a woman has any processing that's done to her hair or has extensions, to remove those and try to have the more of a straightening effect if possible. And as we move on with additional research and clinical observation, hopefully we can come up with more tools to enhance the protection in women with all types of hair.
Yeah, it's great that they're looking into that. And thank you for that explanation. And we'll have more resources on that. So I'm curious to know how you approach your patients about this option. My understanding is if you're going to consider this, you need to start at your first treatment. We know that's a time when women are making a lot of decisions. And so tell us how that works.
You're absolutely right. A lot of information, lots of decisions that women have to consider at the initiation of treatment. So, but I make it a point to bring it in the very first visit, if possible. And the reason, as you suggested, is we need to move quickly. We need to make sure that we do fitting to get the sizing of the cap. And then if you use one of those units we've discussed, those caps will be sent to the patients. And I have to say that the different companies that we work with have been very quick to be able to send over the right cap to the patient. There's also some backup caps that we can use if one has not arrived on time. But at least my approach has been to go over my recommendations more globally and to mention the chemotherapy type or types that I'm considering for the woman. And I do kind of at the end say, when we discuss the potential side effects and schedule, I say, well, there's one more thing we need to discuss. So one of the most common side effects is hair loss. It's 100% with this type of treatment, or partial in other situation. And there is a method to try and preserve hair. It may not be 100%. It works for, depending on the treatment, I will tell her if it works for 50% of women or 90% of women. And I'll say the reason I bring it up today, because if you're interested, we're going to do the fitting today and get moving in the paperwork. You can always change your mind, but it is time sensitive. So most women are very receptive to this. Most women are able to make a quick decision, like, no, I'm not interested, and I'm fine, or yes, I do want to consider this, let's do it.
Yeah, in talking to a lot of women over the years, I know some feel guilty, like, why should I be worried about my hair when I have a life-threatening disease? But I think it's a very individual decision, and they need to know this is an option. And so that leads into the next question, which is, what do you see as the benefits of doing this, or at least trying it?
So again, as you've said, Jean, this is an individual decision. We're here to support the women as they make their decisions, and there are many, as we discussed. And if it's something that a woman feels would help her get through her treatment, and again, you sometimes don't know how you're going to feel until you go through this hair loss. And I've seen it enough to know how hard it is for women who didn't expect it to be hard for them. So I'd like to always bring this up as an approach that they can take if they desire, but they don't have to do it. Everyone is different. Right. Again, if a woman feels that this is part of her identity and it will be important for her for any reason, whether it's personal, sometimes doesn't want to appear different in the place of work. There's so many reasons, but whatever her reason is, we're there to support her.
Yeah, that's so great. And I know for some women with young children, it's often they really don't want to upset their kids. So it's a personal decision. I'm asked this question a lot, so I want to ask you, do you think there are any risks to doing scalp cooling?
So that's an important question. And I've researched that pretty carefully for quite some time. In fact, the first time we considered it was more than a decade ago. And at the time, with some of the initial cooling opportunities that were available, there was some information and concern that came post-marketing that maybe there's an increased risk of scalp metastases, which are pretty rare. So the thought was that maybe if you freeze the scalp and you administer chemotherapy in the early setting, that maybe if there are any cells that are in the scalp, that you might be freezing those cancer cells also, and then you allowing them to grow in the future. But as more time has passed, the technology has changed. And we also realized that for many, many women, we give chemotherapy with very, very low risk of a cancer recurrence. And if they have micrometastases, those may be more kind of floating rather than settled in different parts of the body. Then it's unlikely that this would be the case. So I've talked to a lot of people and reviewed the literature, and it was my assessment that it was safe for the majority of our patients. If a patient has any concern, and it's something we will have in the conversation, I would mention that it is possible. And then if a patient does have metastatic cancer, then I think that there's less of a concern because there are other parts of the body where there's metastasis that we're treating more aggressively. So is there a potential slight risk? Maybe, but again, the evidence to date suggests that it's unlikely or it's minute.
Okay, and then I just want to make sure we talk quickly about cost. I know this is not covered at this point by insurance. So tell us what you know about the cost, and are there places people can get support?
So as you mentioned, Jean, today, this is not covered mostly by insurance. It is part of our guidelines today. So it's recommended as a level 2, which means that hopefully it will lead to support in the future. There is now a CPT code, so there is a billing code. So hopefully with time, we'll be able to get the insurance to cover this for our women. It is just another tool to reduce side effects to treatment, in my opinion. There are some entities that would help women, and I have to say, at least in my side, my navigators and nurse practitioners are more up to speed on that, but there are some foundation like Here to Stay, the Sue Paxman Foundation, and also Cool Capital, I believe. And many of those are based on need, but some are also based on perhaps age or women with young families or other considerations. The other thing I will mention that at least with some of those cooling entities, and again, I'm not familiar with every single one, there's also a lifetime cap. So a woman will not have to pay every time she uses this. So if she reached a certain amount of money that she paid out of pocket, then she can continue to use the cap free of charge.
Right. Yeah. So Hair to Stay is a good resource. I do want to let everyone know that Living Beyond Breast Cancer has an LBBC fund, and cold capping is something we will support. So you can look for that on our website. I know it's because you have to make the decision so quickly, and then cost comes into into play kind of immediately. I'm hopeful one day it'll be covered. We know they've been doing this in Europe for many, many, many years. So it's good that the United States is catching up. Well, I want to thank you so much. This has been really, really helpful. We have a lot of resources on our website. We have several blogs from women who have done this, both with some with a lot of success, some with moderate success, some maybe not with success. So I think there's a story for everyone. And the Paxman website does have some good tools about what chemotherapy is, what you can predict your success. So we'll post all those resources. But Dr. Stearns, I really want to thank you for your time and your compassion to your patients. And we just loved visiting with you this morning.
Thank you so much for the opportunity to talk to you this morning and for all that you do for our patients.
Thank you. So just want to remind everyone, Living Beyond Breast Cancer is here all the time to provide support. Go on to our website, lbbc.org. If you want to connect more immediately, we have closed Facebook pages. So go on to our website. We'd be happy to add you to one specifically for young women and one for all stages and all ages. Or if you want to call our helpline, we can match you with someone with a similar circumstance. So take care and stay safe.